Painful bladder syndrome, or interstitial cystitis, is a chronic pain condition that affects generally more women than men, and it usually starts in your 30s and 40s. That being said, it can obviously affect anyone at any stage of their life. And when you suffer from interstitial cystitis or painful bladder syndrome, it is exactly as the name says. You get pain in your bladder or in the area between your belly button going down. And the pain often feels very neuropathic in nature. It feels very sharp and shooting and burning, and it can give you symptoms as if you have a urine infection. So it can feel really nippy if you go and pee, or it can feel like you often need to empty your bladder more frequently than perhaps you ordinarily would. Nobody knows exactly what causes interstitial cystitis, and it's important to exclude lots of other urological, gynecological conditions, such as a urine infection. So if you are experiencing symptoms of a urine infection, and by that I would mean having to go to the toilet lots or this sort of peeing, burning sensation, you actually need to make sure that your healthcare professional, your doctor, actually checks your urine for any evidence of infection, and that can be done via dipstick or sending off to a laboratory. It's common for people who have interstitial cystitis to feel like they've had infections for a long period of time and to have had multiple courses of antibiotics and actually not have improved. And that's where we need to start thinking about these other conditions. And a lot of the problem is caused because the nerves which supply the bladder and the urinary system, the urethra, become irritated and overactive. And nobody knows exactly why that happens. It could be because of a previous severe urine infection. It could be because of hormonal changes, or it could just be one of these reasons that we never ever get to the bottom of. There's a number of medications that can be useful. Anti-nerve painkillers, the anti-neuropathics, can sometimes help control the symptoms. There's also a number of individual interventions that an individual can do that will help. And that would be things like cutting out anything which will potentially irritate the bladder itself. So reducing caffeine intake, stopping smoking because smoking can cause problems with it, potentially some hormonal manipulation, and then also trying to reduce the amount of intake of fluid just before you go to bed at night, because we all know there's nothing worse than if you're up throughout the night to go to the toilet to pee.